Jasmine Davis, and I will be discussing my overall practicum experience at Richmond Behavioral Health Authority's Rich Clinic located in Richmond, Virginia. If you will follow me to the first slide, we will discuss the purpose of the practicum. The purpose of the practicum was to develop a predefined project that aligned with MPH competencies to address an unmet need within an organization that would possibly lead to a population impact. So I chose to partner with the Richmond Behavioral Health Authority's Rich Clinic to assess promoting healthy sexual behavior and STD, STI awareness to clients who will be willing to receive more information. The Rich Clinic provides integrated care, which includes mental health, substance abuse, and primary medical services to clients in the Richmond area. The acronym RICH stands for Rich Integrated Community Health. Also, just seeing that STDs and STI awareness wasn't a predominant service that they provided. And they provide so many services to the clients in the city of Richmond. Seeing that this wasn't a main service that they offered, with STDs being a very important public health issue, the goal became to just increase STD, STI prevention knowledge and safer sexual health practices amongst the clients that the company services. If you would follow me to the next slide, we will discuss the design for the practicum. A mixed method research theory was used with this practicum because we conducted a survey of 8 questions that was created through REDCap to gather information from the clients. REDCap, if you are not familiar with that, is a HIPAA-compliant research electronic data capture program that RBHA uses to conduct any type of surveys, whether it's for clients or whether it's for staff, whatever reason it may be. This is the system that they use. So I had to get approval to use this service and to get my survey approved. If you look right here in this picture, you will see that this is the waiting room. This is where the clients were approached to see if they wanted to participate in the STD STI survey. The surveys were available via paper. We had paper copies on hand or electronically through QR codes where clients could scan the code, and then the survey will populate and their answers would automatically go into REDCap. With the paper surveys, I was responsible for putting the responses in and then going in and reviewing the results through REDCap and then exporting them to Excel. Like I said, the survey consisted of 8 questions. The questions consisted of gender, age, race, relationship status, how often do you use condoms, have you ever had an STD, if you have had an STD, what was it, also has the provider ever provided you any STD, STI information, and then there also was an extra question on there that asks if the client or the participant will be interested in receiving any additional education on STD, STIs. The survey and this research study was also available for all clients of RBHA to participate. The Rich Clinic serves clients from the age range of 18 to 85 years old, predominantly African Americans. And as I stated before, these clients are facing substance use issues, mental health disorders, and some are even facing homelessness, and some are actively homeless. So this is a underserved, vulnerable population that I felt would be great for the survey that I chose to conduct with the STD STI topic. So this is exactly why I chose that. And like I said, this is where we approached them to see who wanted to do the survey, who did not want to do the survey. Also, there were only 2 to 3 clients in the waiting room at a time. So it's not like there were 10 clients in there where I was just bombarding them asking, hey, would you like to do the survey? Would you like to do the survey? Each person who agreed to do the survey, I did provide them with a disclosure statement just saying, hi, my name is Jasmine Davis. I am a graduate student at Liberty University. I'm partnering with the Rich Clinic to do some survey research. The survey is completely anonymous. I will not be using any identifiable factors that will trace back to your name, and then explaining to them what the survey was. With the survey being a sensitive topic, I did not always get some yeses to participate, and that's perfectly fine. With the topic being what it was, I was prepared to have people say no, that they did not want to participate, which is perfectly fine. If you come over to slide 4, I will be discussing the accomplishments of the practicum. One of the main accomplishment I would say is partially meeting the research objective. The initial goal was to get 25 clients to increase their healthy sexual health knowledge, and then also getting 25 of them to participate in the survey so I can see what level of knowledge these clients had in regards to STDs, STIs. However, with the increase of the clients declining after I think maybe like week 7, week 8, I decided to reduce the number from 25 to 20. We did get 18 participants, so that's why the objective was partially met. But that alone, just being able to get 18 people to agree to do a survey, actually researching and looking at their results, comparing them, and just looking at all the information that I gathered from 18 people. And I wish the sample was bigger because that would have given me like a large amount of data to review, which would have been great. But I'm thankful and I'm glad that I did get the participants that I had. So that was great just to look over the STDs that people may have had, how different age ranges have the same STD, how married or single people differ in the STDs or STIs that they may have come in contact with. Um, Another accomplishment was being asked to be a health fair recipient. The Rich Clinic turned 10 this year, so they were celebrating their 10th anniversary, and they held a health fair for the clients, and I was asked to provide a STD, STI awareness table. I was partnered with one of the nurse practitioners who did a harm reduction table. And so when clients came by, they stopped, they spoke to me, they spoke to the nurse practitioner. I provided goodie bags with condoms, directions on how to use a condom, lubricant, and a pamphlet that just gave resources as far as getting tested, and then also just information about different STDs. And then I would say another accomplishment for me with this practicum site was also just increasing my knowledge of STDs, STIs. With research, you always learn something. You always learn more than what you already know. And I think this was great for me, just being able to learn so much on a topic that is very sensitive and not too many people want to knock on the door and open to see, how these clients feel about these things. And I think it's very important. STD, sexual health is important as far as I'm concerned. It's the same importance as your physical health. When you go in for a headache or these particular clients, because they are homeless, they are using drugs, they need to be screened for everything because you can go in because they're withdrawing from drugs, alcohol, or anything. But then if they leave any treatment facility and they're not treated for everything, especially being a drug user, these clients are going back outside, sharing needles, engaging in sexual activity, spreading something if they have it, and then just coming back to be treated for detox or mental health issues. And that's not really helping the main problem. So I think that's very important, just increasing my own personal knowledge. Slide 5 just goes over the reflections. Like I said, I did not partially met the objective. I did follow-up calls for our BHA, learning the STD, STI stigmas, not really learning, but just seeing how much the clients felt uncomfortable with discussing certain things, just like seeing that regardless of how much advancement there has been as far as STDs and things like that, that is still a sensitive health topic. This also helped me to have like a little glimpse of actually working as a community health promotion public health worker, just being able to engage with the clients who were participating in my survey, who were asking me questions, just being able to give them some insight. That made me feel really great inside to be able to do that. Recommendations that I would have maybe in the future, allowing the graduate students to be inside while the screening questions are being present, so the provider can kind of like bridge the gap between the student and the STD screening survey. Also, possible incentives. I wasn't able to give any incentives for this research study due to RBHA policies. But I think with having an incentive, there would have been more participants. And also being able to track the clients who actually participated in the survey and seeing how they followed up with their rich clinic provider in the end. That was maybe the biggest limitation that I had for the survey. I wasn't able to tie the two together to see if participant A actually did follow up for with their provider. And that's about it, and I hope you enjoyed my presentation about my practicum experience. Thank you.